You're welcome back to UPFront on the Joy News channel. I'm Isaac Kofi Agyei. And just like I said, we'll be having a conversation on Ghana's demographic and health survey. Beyond the staggering statistics and the ones we shared that you are amazed what are the direction that policymakers can actually take from this statistic that the Ghana Statistical Service have actually put out. I'll be engaging two key, top officials from the Ghana Statistical Service. First, in the studio with me is Dr. Faustina Frimpong-Ngwa. She is the Deputy Government Statistician. She's in the studio with me for the conversation. And we'll be also joined by, Mr. Godwin Agyei JB. He is the Assistant Chief Statistician at the Ghana Statistical Service. Doc, you're welcome.
Thank you, and good evening.
Good evening. You are looking very beautiful this evening as always. The last time I met you, I think it was at the one of the halls, and then you were launching the data hackathon. I must say that the Ghana Statistical Service is doing a very great job.
Thank you.
Well, and then we know one team from University of Cape Coast actually won the competition. I was hoping that the team from University of Ghana will win, but unfortunately we could not get the first place. But the ultimate news was that when they participated at the global level, Ghana Statistical Service came first in the UN data, hackathon. We won more than 3 awards, including the ultimate prize. But tonight, let's focus on the Ghana Statistical Service, demographic and health survey. When you saw the findings, you were part of those who actually took this survey or did this survey. What was that thing that stood out for you in terms of the findings of the survey?
Thank you and good evening to all your listeners. The Ghana Demographic and Health Survey, the main motive or the objective is to provide information or data on the health of the population within the country. And since this is the 7th round, so the first was in 1988, it focused only on women. And so basically it's about women's fertility, the trends in the fertility, the contraceptive use, all about what women's health.
Yeah.
But over the time, they included men and children. And so for us, it was consistent with what census gave us that, the average household size is 3.5. And so that was, makes you understand that even a survey and a sample, the sample one was close to the total because in the census itself we had 3.6. And so if this 3.5, it's very close in there.
There's some sort of convergence there.
Yes. And so for us, our interest is we provide the data, but we expect that program managers and policymakers will use the information. So the information coming from the DHS is to help especially those in the health sector to be able to assess their programs and also be able to monitor and see whether they are on track or maybe they are divergent with what is expected. And again, how do we also be able to measure the SDG indicators as we mark down to the 2030 when it comes.
Now, the reason why I may be very particular about the use of contraceptive is the fact that we are tying this conversation to the spread of HIV/AIDS. We've heard from the Ghana AIDS Commission where about 100,000 Ghanaians are just walking around without knowing that they actually have HIV. Their status is HIV positive. That's a staggering figure over there. And we look at the Ghana Statistical Service, the output of the Ghana Demographic and Health Survey, and you realize that the use of modern contraceptive over the years have actually increased, and then the traditional one is on a decline. What's actually accounting for this? Is it because of the education that you've done, or people are beginning to realize that the modern one is more effective than the traditional means?
Okay, so thank you. And just as you rightly pointed out, some people are walking about or do not know their HIV status. From the 2022-23, I choose to call it 2022-23 because data collection spans from October to the 14th January 2023. So the data collection, in the 2003, we did the HIV/AIDS testing. This round, we did not do HIV testing as part of the activity. But the conversation was to ask people whether they've tested for HIV and other things. And just you rightly pointed out, contraceptive use is for two things. One, to prevent STIs or STDs, and again, to also prevent unwanted pregnancy. So for a woman, a main idea that we want women to use contraception is that if you are not ready for a new baby, then you are living with your partner, then you must be able to protect yourself so that you do not get pregnant. And again, to also be able to space your bets so that if you have a child and you are not ready for the next one, if you don't protect yourself, then when you have an intercourse with your partner, then you may likely conceive. And so you may not want a child, too close.
Wedlock, yeah.
No, if you're out of wedlock. Spacing, yes, too close, because it's not too good for a woman recouping her health, to be able to regain her strength, to be able to carry another one. And so over the years, we've seen that the traditional one, something people call the rhythm or the timing, sometimes it's not 100%,
Well, for clarity, the rhythm or the timing, can you really throw more light on it? I really want to know what that means.
For the rhythm or the withdrawal, it's where a man and a woman is having an intercourse, but when the man senses that the sperms are yet about spilling into the woman, he withdraws.
Oh, okay.
But you cannot be too sure whether you'll be able to distinguish between, am I right at the point, or I have even spilled some already. And when a woman is fertile and is just in that, even one can just fertilize it, so you'll not be sure. But when you use modern contraceptive, whether the injectables, whether the pill, whether the hormonal, you know that it's a blockage. And so you know that between the time you're having that kind of intercourse, you have blocked it and you will not. But when you talk about the contraceptive, there are two types. Yeah. Whether you use the hormonal, whether you use the pill or injectable, you cannot prevent STIs or STDs. Why? Because you can prevent the sperm from fertilizing the egg, but you cannot prevent STDs, sexually transmitted disease, because there's a body contact, even though you don't get pregnant. So the use of condoms prevents two things: STDs, and again, you will not get pregnant at unwanted time. And so these modern methods seem to be the one that test of time, whether we have the short term or the long term. And so the permanent kind of thing is when you go for sterilization. And then the short term can be the injectables that people take, or the hormonal that sometimes can go for 5 years. Then you can go remove and then put another one. And when you are ready to deliver or become pregnant, you can just stop whether your pill or your injectable and the hormonal things, so that you'll be able to conceive again.
Well, I see you spoke about the withdrawal methods, and I'm very particular about that, because let's go back to the data that you put out. And it's actually a surprise if you try to do the urban and rural disaggregation of the data that you put out. You realize that, majority, or there is a higher percentage of the urban population that you actually, who participated in the survey, who said they prefer the withdrawal method compared to the rural, respondents who participated in the survey. I was really shocked when I saw that this type of methodology, or this type of, a way of preventing pregnancy, the prevalence rate is higher, amongst men and women in urban areas than those in rural areas. Were you also surprised when you actually came out with this output?
I think we should place this in context. And so the traditional method, or whether the withdrawal, even though you see the number is slightly higher in the urban area than the rural area, in total, there's a very minimal proportion. Yes. And so the good thing is that, because just as we talk about this withdrawal, people say they want the body contact. People say that when they use condom, it's like putting a rubber on a toffee wrapper and then licking it. But then what we seek to achieve is that to prevent pregnancy and STDs, this withdrawal method cannot be the solution. And so it might be that people want it just because they think that wearing a condom or whatever, but the numbers in there is very, very small. Great. So that's what,
Right, so I want us to do this disaggregation in terms of what I see, the data that I see on page 47. I'm really interested in this because the whole day Ghanaians have been talking about this. there's some sort of sensationalism attached to it, because I mean, when you start to talk about things that are sexual, stuff, people are interested because they want to know what's going on in the country. And I was really shocked when I saw that if you look at the age brackets of Ghanaians or those who participated in the survey, 15 to 24 years, the Ghana Statistical Service asked them a very simple question: do you have 2 or more partners in the last 12 months? And if you look at the female side, 3% of those who participated in the survey said, oh yes, of course, I'm within the age bracket of 15 to 24, but I have, multiple partners, 2 or more, 3%. Now, if you go to the next question that was asked, the percentage of those who said they had sexual intercourse with persons who are neither their wives nor are living with them, the age bracket of 15 to 24 years, you see a staggering figure of 34.2% amongst women. And if you go to that of men, the figure is higher. What do you have to say about this? I mean, I'm looking at the age bracket, 15 to 24 years. Why are we having such a huge... But before you even answer the question, let me welcome Mr. JB on the show. Thank you very much for coming. I learned you were on radio, and then it's the same issue. We are actually interested in finding answers to the data that you've put out, and beyond the numbers, we want to know what policymakers can actually deduce from these figures, so that we do not see the staggering figures that we have at our hands when we have the 8th round. Probably, what was the interval?
And so ideally it's supposed to be 5 years, but 2014 till now to 2022, it was about 7 years.
Oh, okay.
I mean, these are some of challenges, and again, 2020, 21, there about we're doing census, and census is so huge that nothing can come to take the place of census.
Exactly.
And so anything that maybe we didn't do it at the rightful time to be able, then you have to shift. So ideally, the census should have been 2020, and they would have been able to do the DHS 2021, but because census, COVID and other issues, census was pushed 2021, and definitely so we pushed the DHS forward also by a year.
Great. Now let's just go back and deal with the age bracket of 15 to 24 years, who 34.2%. They say that they have sex with people who are not their husbands, or they are neither living with them. I don't know if Mr. JB would like to take it on from there.
Yes, so thank you once again. And the whole DHS is to monitor programs, and we touch on the youth because they are the backbone of the country. So they need to be protected. For that matter, messages relating to HIV should get to them. But then they said what is called the DHS, we ask of the number of partners one has. And for the youth, yes, so the figure you are stating is correct. And we also wanted to find out whether those who have the multiple partners, whether in the last 12 months, the last sexual activity that they conducted themselves in, whether they use a condom or not. So if you look at the figure, yes, those who use the condom is very small, which majority of them are at high risk of having sexual intercourse.
So if you look at the figures, female who use condom, if you look at the age brackets 15 to 24, I am focusing on this because I see this to be young adults.
Yes.
Who, even if we are talking about sexual intercourse, they probably should not really be featuring heavily in here. But you find about 8 out of 10 of the people you sample saying that, well, the last time they had sex, they did not use condoms.
Let's set this in context. And so for the DHS, we focus on women 15 to 49 years. These are women in their reproductive age. This is where we think that women are fecund or fertile to be able to have a child.
Yeah.
And then for the men, ideally, it's 15 to 59. To make our information comparable with the female data, we cut it up from 15 to 49 years. And just as you said, we have these young adults or this youth. And so we also ask information about this youth. And so the question was not just, do you have multiple sexual partners? And so it started with, at what age did you initiate your first sexual debut?
Oh, okay.
Then after that one, we asked that 12 months preceding the survey, did you have sex with anyone? The person responded either yes or no. If he said yes, when you you had sex with this person, did you use anything to protect yourself or the partner protect themselves? The answer moved on to be able to also ask that, apart from this person, what was the relationship of this person to you? What was the relationship?
Like a snowballing technique.
Yes.
You were able to use to get all of this answers.
Yes. And then after that question, we asked, apart from this person that we said you have sex with within the time we have talked about, did you have sex with another person? If he said yes, did the person protect myself or you yourself? And again, what was the relationship? Then there was a third question. Apart from these two you've talked about, did you have sex with somebody else? And so it is gradual process. So we didn't just go out and say, do you have sex with multiple?
Nobody will.
No, but it was like,
yes.
Have you sex? And who was it? And apart from that one, have you had sex within the time frame?
We were more like doctors, to the respondents.
So if I become in, like we wanted to look at what actually happened as against our strategic plan. We have the National HIV Strategic Plan for 2021 and 2025. So we have those 15 to 24 with 2 or more partners. And they constitute the 3%, that is the male, the female.
Female.
Yes, 15 to 24. But when we take a look at our the strategic plan on HIV, for 2022, it's been projected that we should have 2.2. So if you take the 3.0 that we have, it means that we were not able to hit our target.
Oh, I see. So we missed that target.
Yeah, so we comparing the results to our target, because the program managers do set targets. So we go to the field, pick the information, then we look at whether we are doing well or not. So that is the results. And even for the male counterparts, the men, the figure is 10%. 10%,
9.9.
Yes, they have 2 or more partners. And then the target was 7.7 or 8%. So over here too, we've missed our target.
And to add to that, and so it's not Saska Service who is portraying the populace as something, right? But the target set by the National AIDS Commission is that in their mind, they think that depending on maybe strategies being put in place, females who will have 2 or more sexual partners should be about 2%. And we are saying that, so it means that they know it exists.
Yes,
but in our data,
we cannot do away with.
But in our data, we saw that for those who are 15 to 24 years, it's 3%. So what we're saying is that AIDS Commission, your target was 2.2.
We missed by 1 percentage point, right?
We are telling you that in 22-23 data, that's when we collected the data, is the prevalence is what? 3.0. And so it means that our information is to help policymakers to monitor the programs they are put in place and to evaluate their programs. And therefore, with this result, they have to go back to the drawing board and see what they can do if we want to achieve 0 percent in 2030, SDGs, so that if you don't have multiple sexual partners and you're not protecting yourself, then we cannot limit HIV spread, we cannot count it out. And therefore, if we are mid-year between 2015 and then 2030. And so we should be able to know, are you able to have or get to so close that you'll be able to say that by 2030, you will be able to take away all this percentage. And so there's much more for us. Our duty is not, when we put the figure out, our duty is to help these program managers and then the policy makers to take the right decisions to help achieve the goals that have been set for us.
Well, I'm sure you have, data from previous rounds. Do we have any comparative analysis to check if there's been improvements? You talk of 3%, the target is 2%. I really want to know if we made progress or we are stagnating or our situation is currently worse. I would like to know, because is a very important indicator that we are working towards.
Yeah, so we came from somewhere. So basically, if you look at the previous records, yes, like we're doing well, but still we can do more than what, because it's based on those previous records that the targets were set. And then now we are not meeting the target. So let me even also go ahead and state that for the women 15 to 49 and men 15 to 49 who had multiple partners who were neither their husband or wives, or they don't stay together. The expectation is that they should use condom to protect themselves. So for the women, it's 23%. But then the policy target is, we're expecting that 34% of those in the what is called multiple sexual partners who are neither their husband and those things should be about 34%. But we did 23%. So it means that we were not able to hit our target. Equally for the men too, they recorded 34.5% who have what is called in their last sexual encounter with somebody who is neither their husband or this thing. We hit 34.5%.
So are we seeing a decline or there's an improvement?
Yeah, there's an improvement, but where we have targeted, we didn't. Because for the men, we targeted that such persons, at least 55% of them should use or protect them. Not
so condoms,
condom,
right?
Yes,
protection.
Protect themselves. But then we ended up having 34.5%.
Now, you're speaking about men. When we put out the statistics today, per the data that we have, men who actually are married but still have extramarital affairs, it's about 18.4%. If you are doing the computation, we should be talking about 2 out of 10 married men. When we put this figure out there, people were saying, but I mean, we all know that men who cheat in the country, they are not 2 out of 10. People are even saying it should be 9.9999 over 10.
Yes, I think for this particular indicator, we didn't tie it to men or women who are married. So it is not, and we also didn't state that they are cheating or not.
Well, so you have let me just clarify this. So if you go to page 48 of the document and you look at the background statistics and you you go to the marital status, you have 2 categories, 3 categories there. You have persons who have never married, persons who are married or living together with other people or other partners, and you have people who are divorced, separated, or widowed.
Yes.
Now, if you map all of these 3 indicators to whether you have more than 2 partners, whether you are having sex without protection, for instance, those who have never married or in a common setting, we say are single, never married, but they are having 2 or more partners. If you look at male, those who had sex, but they are not married, it's around 46%. That's like 5 out of 10 people that you select from that age bracket. Can you give us clarity on that?
So let's put this whole story in context. And so in the GHS, we are not saying it's married. Let me explain one thing about married and then the cohabiting. And so married is the one that they have performed all the rights. Cohabiting is like we are living together. And so it can be that we have not performed the rights, but maybe our family members know that we are going out or something and we live together. So nothing has been performed. We have people who are living together, nothing has been performed. We are saying that for those who are either married or living together, then that's the percentage you are talking about.
Exactly.
And so we are not here putting, because for some, if somebody is cohabiting, you may not know whether sometimes you may have a man who has maybe 3 or 4 wives.
If you are cohabiting, you are actually expected to keep the fidelity, right? You are expected to be faithful, because we are cohabiting towards marriage, or we are actually doing all the things that married people are doing, just because we do not have the money to perform the rights. So if I am married to you or I'm cohabiting with you and I go and have extramarital affairs or I go and have sex with another person, that's tantamount to cheating.
So hold on. I think that let's set the ball straight. I think that our mandate is not to come and say A is cheating or A is not cheating. For us to be able to direct and help policymakers make decisions that will help us, what we are interested in saying is that somebody who had an affair with another person without protecting him or herself is likely to attract sexual transmitted diseases. Or if it's a woman, is most likely to be able to become pregnant. If I'm pregnant at the time that I am not ready for a baby, it has its own effect. If I bring this unborn baby into the world, I may not even like that child because I was not ready for the person, or I may not devote much time for the growth and development of that baby. And so for us, this information we are putting out is to help the program managers, those who are interested in looking at prevention of STDs. How are you taking this kind of information and reach out to these people, whether in the younger age group or whether in the older age group, and then address this issue? Again, this survey is not for all men, so we shouldn't go out and say all men, because if you say all men, this information is reference to those who are aged 15 to 49. What if somebody is also married and is, let's say, 50 years or 51 years and faithful to one partner? And so let's place this in context. In context in that within the 15 to 49 years is deemed as the reproductive age where you can produce or have that kind of thing. And so what we are saying is that these people who are within this age group, this is what we have found. And so targeting this group with their messages or with your programs to help alleviate or address this issue. So for us, our mandate is to research and put out the findings. Then those who are the program managers and the policy makers, they take this one and the measure. All that we try to do is that we brought this one in context with the Ghana AIDS Commission strategic document, because in their document, they have said that by 2022, it should reduce to 2.2. And we are saying that, look, by your own targets, from my results, you have not achieved it. And therefore, if you want to move forward and achieve your target, you have to up the game. And therefore, put in place strategies and other things that will help address this concern that we are. That's how we came from.
Exactly. I mean, there was one thing that I actually, realized or saw, discovered in the report that you put out. I was looking at the sample size, and I realized that the more we venture into the older age bracket, the more the sample size reduces. So we see the sample size reducing the more we increase the age brackets. Was this a strategic approach in helping you to get what you really wanted from the survey?
No. And so when you take the population of Ghana, the population structure of Ghana, like it's a pyramid, the population pyramid. And so in the 1960s, it was very broad-based, more children, and as it's going up there, it tips. And it gets to the top, it is very narrow. Over the years, you have seen that even the broad base, even though it's still broad at the base, it has narrowed. Okay? And so now it's not like 50% of all the population are less than 15 years. Now the bulk is rather between adolescent, youthful age. The 15 to the 34 years form almost the bulk of the population. What strategy will you put in place? And so in the sampling, I did make mention that the study is supposed to look at reproductive age. And so why didn't you ask women questions about those who are 50 or 50 plus? Because within the literature, women, even though women are fecund or are fertile, are able to produce between 15 to 49 years. And therefore, this was a focus because we wanted to know their fertility.
So those above are completely out of your sampling frame?
For this particular survey. But then within the sample, what we did, first of all, we took, Ghana is divided into urban and rural. Okay. And again, Ghana is divided into 16 administrative regions. And so in our sampling, again, for this particular survey, we wanted to make sure that we had information from every district. And so in this particular data set, when we did the sampling, it is across the 16, represented across the 16 regions, and we make sure that each district has some for information, but that one district will not be like huge enough to say, I'm making this district estimate or information. Out of the total that was selected, so selected as 618 thereabout enumeration areas. These enumeration areas are small unit area that Ghana's Health Care Service we have devised to be able to help us canvas in undertaking our activity. Now, because DHS census was just
2021,
and this one was later part of a year. When we sampled these admission areas, we went down to the field to do a listing. Why? Because we don't have a register where we say that when somebody moves from one district to the another, we record and we transfer. And therefore, it's a year over or whatever, we wanted to go back to the ground to be able to ensure that the people who are going to get in the frame is what we needed. After we have selected the listing and it was completed, we sampled 30 households from each of these number we are looking at. Now, within the 30 households, the 30 people that we talked about, that got us 18,000 plus. Now, we're able to interview people from households. So it was 17,933. And then within this 17,933 households, we're able to interview individual women, 15,000 plus.
I see.
Now, because the focus is on women were the main target because their fertility preference and all other things is because of women. But however, woman does not get pregnant all by herself. A woman needs to, when a pregnant woman, you need to go to the health facility. Some you need support. So the best person will be your partner or those people within your immediate environment or your household level. And so within the sample, half of the households, so out of the 17,000, we took half in which where women lived to be able to interview men who are within the 15 to 59 years. But to make it comparable with the female data, we limited analysis to 15 to 49 years to compare. And so that's why you see that maybe women are 15,000 plus and the men were about the 7,000 to be able to. But the focus, of course, we wanted to know their fertility, their preferences, and other things. And one thing is that we are interested in a woman's fertility because as a woman who gets pregnant, who carries the child for 9 months. So a woman will hardly forget that I was once pregnant. A man is a donor. So somebody can just go out and donate and may not even know that it ended in a pregnancy. Assuming that you came to Accra and have maybe a casual acquaintance with somebody and traveled on to, let's say, Savannah, my region, then you may not know you left a seed in Accra. And so we say that we take the fertility of women because these are the people who carry the to birth 9 months, and again, they will know the processes. And so most of the questions are really in relation to women when you talk about the travel time and other things, because it is when you become pregnant, we've seen that maternal mortality, that death occurring to women during pregnancy, at delivery, and 42 days, within 42 days after delivery, is called a critical point.
Absolutely.
And we are seeing that maternal mortality is high in the country. And therefore, the focus is when women were pregnant, did they have access to health care? Antenatal, that is going to check on yourself and the features that is within you. During delivery, were you attended to by a skilled professional, a nurse or a doctor or midwife? Or so that if you went for antenatal, we believe that going through what WHO calls us to be the minimum of 8, why we realize that sometimes people don't go to the health facility early enough, so that if there are complications, and it's too late to go, and sometimes we might lose their mother and the unborn.
Well, Doc, very fascinating point that you're putting out, but we will come to the health facilities because it's very, very important in this conversation. But I just saw this data. And the age bracket of concern to me is those who are between the ages of 15 to 24 years. And again, I'm going to the HIV domain because if you look at those who have never tested, this age bracket that I just mentioned, about 70% of them say they have never tested. And this is the same age bracket who are actually having multiple partners and having sex. Is there anything extra to this? Because, I mean, even if you reduce the age brackets, I would like to bring in Mr. JB on this.
Yes.
If you reduce the age bracket, 15 to 19 years, about 90% of the respondents said they have never tested for HIV as before, and that's staggering.
I think it boils down to the education the need for us to test regularly so that we know our status. Because if you look at the national level, the figure is low. Those who have ever tested and received the results for women is 54%, whereas for we, the men, is 24%. And those who did it in the last 12 months is even very low, a figure of 15% for women and just 7% for men who have tested in the last 12 months. So if you look at testing in general, the coverage or the proportion is very low.
Well,
and
it translates to the 15 to 24 years.
Let me chip in something.
Well, they'll come in briefly. Yeah.
And so when you look at HIV/AIDS testing, let's understand that maybe the last time we did testing as part of our DHS was 2003. And even Ghana has been, because the prevalence was around 2%, and so we have been considered as a low at-risk country. And so maybe, like we are saying, around those times, because HIV was everywhere in terms of adverts and in terms of programs, people were conscious and people were really talking about it. It seemed because we've been tagged that we were low, we have not given that consistency into saying that people should test.
And we have like 100,000 people walking around without knowing their status.
No,
because people are HIV positive.
From the information that we gathered, right? Let's be frank. When you are there and I'm going to go for seek a job, nobody will ask me, bring me your HIV status. But when you are pregnant, it is mandatory to go in for HIV testing. And so if it's as a policy, we want to address the spread of HIV among the general population, then I think that policymakers and program managers should focus on making it like HIV testing is required for A to B, then people will be sensitized and they will go and test it. So right now, is when people, in some places, when people are going to get married, they ask them to test. Or some people, when you are pregnant and you go for antenatal care, it's mandatory. The doctors will ask you to go and get your HIV test and then the status. So when you talk about the last, just as we said, this round, our focus was not on the testing, but their knowledge. And so we just asked people out of their own free will that within the last 12 months, people tested and did you go for the results? And that's why we found those information. So I think it's something for policymakers to take it up and work on.
Quick one from Mr. JB. Enough of the sex and then the HIV. Let's talk about, our health infrastructure and the distance that people would have to cover before they access, healthcare. Just recently and today, we had a very broad conversation on our latest documentary called Sick Hospitals, and you see the status of some of our even, quote, big hospitals. It's an eyesore. What did you actually discover in your survey?
Yeah, so we identified that still a sizable proportion do more than two hours. But then once it's closer to you, easier for you to get to the facility within a very short time so that you are treated. But if it takes a longer time for you to get to the facility, then that would not be good. So as a policy, we should try as much as possible to reduce the distance to the nearest hospital. I think there has been a lot of interventions like the Chief's Compound and although making sure that every district has a district hospital and all this, all in a way to minimize the distance to the health facility.
Great. Well, Doc,
can I chip in something?
Of course,
here?
yeah.
So in the 2021 Population and Housing Census, we listed every structure, and so we asked what is this structure being used for, and so we have health facilities. So we churned out a report called Proximity to Essential Services.
Exactly.
And so over there, one of the things that we set out to do is that in terms of healthcare, there are three kind of delays. The delay from the side of the individual. Maybe I'm sick. Go to the hospital. I won't go to the hospital. So you delay until maybe you get to the critical point.
Yeah.
And another delay is your mode of transport or getting to the facility. So it's taking you too long to get to the facility. By the time you get there, we believe that within an hour or if somebody gets to a health facility, something can be done about it. And again, the health facility itself. In the DHS, we did not talk about the health quality facilities that are within the health center. So to be able to know whether they have the IMOC or they have all other things. But what we're interested in...
Well, this is getting interesting, so we'd like to take a break. When we come back, we'll continue with this conversation. You're still watching Upfront on the Joy News channel. We are taking a quick break and we'll be back. Watching Upfront with me, Isaac Kofi Agyei. I really wish that, Doc, we could actually continue this conversation, but we certainly must have a part 2 because it's getting interesting, but we do not really have time. I know you are working on, I mean, we are a big consumer of your data, and I know you are working on the business survey and other ones. Can you take us through the number of surveys and work that you're doing? You're doing a really fantastic work, and you're making data available. I mean, we pick data from your data bank almost every time. Can you take us through some of the project that you are working on?
We have the Integrated Business Establishment Survey. We call it Integrated Business Establishment Survey, but it's synonymous to a census. So we are doing census of all establishments, whether big or small, for profit or non-profit, whether it's in the open space or whether it is a well-structured area that we are collecting. The essence is to be able to help us to be able to profile how many businesses are within the Ghana space. What is their size? Femology, so the size, the number of people that they employ. And so Joy, who are part of the people, churches, whether small or big, everyone is part. And so currently we are the 14-day and data collection. And so we are all over the country, everywhere in all admission areas. You find our people in the jackets and the ID cards, and then also introductory letters going around and then soliciting information about all these businesses in there. We'll ask the general public to participate because this will be able to give us the information to be able to tell the country that this is the number of firms we have or businesses we have in the country. This is what we call the establishments or the big ones or the small ones. Surprisingly, this year we're working on something that we call the hawkers, informal businesses. Traders, so sometimes people think that, business, and somebody say, okay, maybe I sell by the roadside. All these informal are businesses. So we want to know what is the proportion of in terms of the size that we have. And then from this phase, we'll move on to the second level. The second level, we will sample and go back to have detailed information. So we'll ask the general public to participate and then help us. Apart from that, we also have the Cohabiting survey. And so so the Cohabiting survey is a collaboration between the Ghana Statistical Service and the Ministry of Agri. And so the essence is, we sometimes estimate that this crop size or from this acreage we will have maybe 1 ton of maize or whatever. So currently they are on the field doing the listing where they'll be able to see the farm sizes. And then they will sample some of the farm sizes before the farmers even cultivate. And the idea will be that what are you going to prepare this land to do? So if you say maybe an acre of land, but I'm going to prepare, let's say, cultivate maize. And so they will take measurements of the size of the field that you are going to use. And then whilst you are cultivating, the Ministry of Agriculture will come again. And when it is time for harvesting, also come again. So you'll be able to measure that with a land plot of maybe 1 acre, when you plant maize, with this maybe, whether fertilizer or manure or whatever, we expect that by the year of the season, we'll be able to harvest so and so, or maybe 2 tons, or half of that one, and then how many maize on their way. And then also, finally, we are about conducting the Ghana Living Standard Survey round 8. We have done the listing, and then we are now preparing for the main survey. And this year, our focus is on education. Great. And so we're collaborating with Ministry of Education to have an expanded program in that.
Doc, I'm really grateful that you were able to join us. We had a conversation on the Ghana Demographic and Health Survey. My guest is Dr. Faustina Frimpong, and she's the Deputy Government Statistician. We're also joined by Mr. Godwin Odejebi. He is the Assistant Chief Statistician at the Ghana Statistical Service. I'm really grateful that you can join me. Folks, at this time will allow us to peg our conversation. Joy News Prime is up next.